Welcome to AETCM, the emergency medicine channel. From today onwards, we are going to start a new series, that is endocrine emergency. So in this series, I want to cover major 5 diseases or conditions. First one, we are going to deal regarding the diabetic emergencies, that is hypoglycemia, DK and then HHS. And then we'll see some thyroid disorders, hypothyroidism and hyperthyroidism. Finally, we'll end up with the adrenal insufficiency. So those are the outline for the endocrine emergency. So in this first part, we'll see the diabetic emergencies. Okay. In diabetic emergencies, today's our area of focus is a hypoglycemia. So getting into the definition of hypoglycemia, hypoglycemia is a clinical syndrome characterized by the low plasma glucose level, that is the level will be less than 60 milligram per deciliter. Symptomatic sympathetic nervous system stimulation. If the hypoglycemia is more severe form, that is less than 40 hypoglycemic crisis means, then you will get a CNS dysfunction. So in this definition, we have a 3 major important partisans. So let me explain one by one. First one, hypoglycemia is a clinical syndrome. Syndrome means what? It is a group of signs and then symptoms, right? So here in hypoglycemia, you will get some group of signs and then symptoms. So what are the signs and then symptoms we will get means, first signs mean what? It is a subjective, it's a objective data, means we will assess and then we will find something, that is a sign. Symptoms means whether the person will complain us, or that is a subjective data. So what are the signs, what are the things we are going to assess means, first in hypoglycemia, by if you are doing the glucose test, or if you are doing a laboratory glucose test means, there you can find the low plasma glucose level. That level will be, as like I told, it is a less than 60 milligram per deciliter, that is a sign. Okay. Symptoms part, what are the symptoms we will get means, the symptoms of sympathetic nervous system. Okay. What are the sympathetic nervous system symptoms we will get? So we will get a fight or flight response, means we will get a tachycardia, palpitation, and then diaphoresis. So those are the things, symptoms will arise in the case of hypoglycemia. So this is the, again, hypoglycemia is a syndrome. So syndrome in the sense, it is a group of signs and then symptoms. So signs wise you will get a low plasma glucose level, symptoms wise you will get a sympathetic nervous system stimulation. So in severe form, in a hypoglycemic crisis, so level less than 40 milligram per deciliter means, there you can see the CNS dysfunction, means you can see the altered mentation, stupor, coma, unresponsiveness, unconsciousness, those and all will occur in the severe hypoglycemia. Okay. So response to the hypoglycemia means, so whenever our body gets altered from the normal physiology, the body itself try to compensate the condition, means that is a compensatory mechanism. Here how the body is tackle over the hypoglycemia, there are 2 mechanisms that will happen. First one, it will temporarily, it will stop the insulin release. Okay, temporarily it will stop the insulin release. Second one, it will secrete the counter regulatory hormone. Means what are the counter regulatory hormones? So those are the hormones, they will increase our glucose level. First hormone, we have a glucagon, so that will secrete from our pancreatic alpha cell. Again cortisol, where, so it will release from the adrenal cortex, right? And then we have a growth hormone, so that will secrete from our anterior pituitary gland. And then we have a catecholamine. So catecholamine in the sense, that is a adrenaline and noradrenaline, again that will release from the our adrenal gland. So these glucagon and cortisol, they have a glucocorticoid properties, mainly cortisol, they will increase our glucose production, or they will increase our glucose level. This growth hormone and catecholamine, they will suppress or they will inhibit the insulin release. Okay, okay. This is the secretion of the counter regulatory hormone. So 2 mechanism. First one, it will temporarily stop the insulin release. Second one, it will secrete the counter regulatory hormone. So in counter regulatory hormone, you can see the catecholamine release. So this is the reason why we are getting the sympathetic nervous system stimulation symptoms. So in definition we told, right, so you will get a symptom of sympathetic nervous system. So because of this catecholamine release only, as a counter regulatory mechanism, we are getting that symptoms. Then, so first line defense, ultimately your glucagon and then catecholamine will come in act, and then if it is a prolonged base of you want a recovery means, then cortisol and then growth hormone will take over. So what are the types and then related causes? Types, majorly we have two types, that is a relative hypoglycemia and then spontaneous hypoglycemia. And then one more thing, that is pseudo hypoglycemia. So what is meant by reactive hypoglycemia? So the name itself very explained manner. So that is a reactive, means it is a reaction of something, right? So it is a reaction of something. What, because of hyperinsulinism, that body is getting in the hypoglycemia, means there is a excess insulin level in the body that causing the hypoglycemia, that is a reactive or reaction of hyperinsulinism. So in this case there might be some other things, like already the person might have a history of diabetic, for that he made in the insulin therapy mistakenly or deliberately he may took less amount of food but with the same dose of insulin. So that is a one reason. In other reason, you have to think about the some toxicological oriented also, means something like a homicide, suicidal causes. Sometime to suicidal attempt also they can take some insulin and then they can try for the suicide. In some other hand, like homicidal cases, so the person, some other person want to kill someone means they will administer more amount of insulin. So that's why toxicological point also as a EMT paramedic we have to think. So these are the things when you are in the scene, like you are going to receive a case means, then thoroughly you have to assess the scene. If you found any empty vials or syringes means, ultimately you have to document those are the things. If it is possible, you can take a pic and then you can take those are the like syringes, vials. If it is permitted, you can take from the scene and then you can hand it over to the definitive care. So if it is actually we should not do those collection of files and all, we should not, we have to straight away report to the police or some other public figure. That is the ideal thing. So if it is permitted, you can take a pic and then you can document everything in your notes, and then you can, while giving an definitive hand over in the definitive care, you can explain those other things. So that is a reactive hypoglycemia. So you have to think in the term of first one, those who are under the insulin therapy. Second one, in the term of toxicology, homicidal and then suicidal attempt. And then second one, pseudo hypoglycemia. Pseudo means that is a error, or it may be a laboratory error, or in the case of polycythemia or leukemia cases, that cell itself they will consume all glucose that present in that vial. So because of that only the person it may show as a hypoglycemia. So to correlate that, you can do the field glucose test or you can do the glucometer test, thereby you can correlate the level, or you can go with an ABG or VBG also. So spontaneous hypoglycemia means this thing will mainly occur in the non-diabetic cases. So reactive will occur in the diabetic peoples, spontaneous hypoglycemia will occur in the non-diabetic cases. So the reason, alcohol and then malarial sepsis, so anti-malarial drug like quinine and then salicylate also can cause the spontaneous hypoglycemia. How we can differentiate between the spontaneous to the reactive hypoglycemia? So we told only two things only we'll see, either reactive or spontaneous. How you can differentiate means, there we have a one triad called Whipple's triad, means the Whipple's triad consists three things. First one, the person will show the symptoms of hypoglycemia, means you will see the tachycardia, palpitation, diaphoresis. Then you have to check the plasma glucose level either by the, so better you can go with an glucometer, field glucose test. There you can find the hypoglycemia. So means first is a symptom, second is a sign. So ultimately the person fulfilled the two criteria. So what we are going to do? So we have to first we made the diagnosis, the person have a hypoglycemia. We don't know the reason, but the person have a hypoglycemia. So we are going to treat the hypoglycemia by giving the dextrose containing solution. So once if you loaded the person with a carbohydrate, or once if you address the hypoglycemia, you can see the reversal of symptoms. So the person's like symptoms, so what are the things that arise, right, that will resolve. So this is the thing will occur in the spontaneous hypoglycemia. It won't occur in the reactive hypoglycemia. Means in reactive hypoglycemia we told that is because of the hyperinsulinism. Insulin in the sense, it is not about the injection format. You have OHA like oral hyperglycemic agents, sulfonylureas, metformin, those are the things also included. So in this reactive hypoglycemia, what will happen means, so each drug have some duration of action. Means if you are taking your human atrapid, means that have an action of 4 to 6 hours. So once the person developed hypoglycemia, if you given a 25% or dextrose containing solution, means for temporarily it will complete that hyperinsulinism. Again, because of that drug, again the person will develop the hypoglycemia. There, that is why we told in spontaneous hypoglycemia, the person will get alright by get alright, but in that reactive hypoglycemia, it won't be. So it will take some time. So if the person have a misuse of human atropine, means at least you have to treat the 4 to 6 hours, or more than 6 hours the person need a treatment, then only the symptoms will resolve. So that is the way you can differentiate. By Whipple's triad, you can differentiate spontaneous to the reactive hypoglycemia. So that the same thing, only summary. And then clinical features also same thing. So what are the neurogenic symptoms? So that is the sympathetic symptoms like sweating, tachycardia, tremors, palpitation, anxiety will get. And then neuroglycopenic. So if it is severe hypoglycemia, you can see the dizziness, headache, clouding of vision sometimes. So it's like I told, hypoglycemia crisis and all, you can see the behavioral abnormalities like altered mental status, convulsion, coma, unresponsiveness also can occur. Nocturnal hypoglycemia means it will occur mainly at the night time. So in this cases, the person will, majority of the cases it is a asymptomatic, because at the night time, because of the night time the person won't get that much symptoms. But here the person may feel a poor quality of sleep, and the nightmares, night sweats, those are the things will arise. So others like memory loss, incoordination, slurring of speech, dilated pupil, seizure, and then coma in severe cases. So while doing an assessment, we have to do the thorough assessment, because slurring of speech, so those are the things will comes under the, so those are the things you can see in the CV also, stroke cases also. So you have to make a thorough assessment. So if you are suspecting hypoglycemia, means you have to work for that. If you are suspecting, so 2 or 3 causes, so provisionally you are suspecting like CV also, means you have to do that fast assessment also. So everything you should have a clear idea. So history and physical examination are assessment point wise. So remember, so in hypoglycemia, so you just follow our what we are following our assessment part. So first step we have to do the scene size up. So scene safety of your crew, and then your crew members, and then patient side, and then you have to take your additional precautions measures, and then personal protective equipment. So everything you have to keep in mind. Second thing, you have to assess the mental status of the person. So mental status wise, mainly you will get a two group of people here. First group, there is a person of awake and then alert. So based on the AVPU scale, awake, and then the person will be awake and alert. Might be he will be like a oriented with you. So in this cases, straight away oriented, or you may get a disoriented case also. So we'll see both cases. So disoriented. So in this category, so because of this category, this is the first category, right? Awake and alert, oriented, and then disoriented. Might here also the person will have some symptoms like tachycardia, palpitation. So that is the first criteria fulfilled in hypoglycemia. Then again you have to check the field glucose test by the glucometer. Thereby you will diagnose the person of hypoglycemia or going to treat. In second scenario, you will get the person in an unresponsive state. Okay, so these are the practical point I am telling. So if you are getting the person with the unresponsive or altered mental status, means first, so you just see unresponsive. So the person is fully collapsed and then coma state, means first step what we have to do means, as like I told, C incisive is a fixed one. Second thing, you have to follow the BLS protocol. So because here we are telling about the hypoglycemia. So without so leave the hypoglycemia. So if the person is unresponsive, means first step scene size up. Second step what we have to do, we have to do the BLS step. So we have to check the response of the person by tapping and then shouting. Third step, you have to check the cardiac and then respiratory function. So by palpating the central pulse, and then you have to see the visible chest and then abdominal movement. So if both things are there, pulse and respiration is there means straight away your next step should be assess the glucose level. Okay, so you have to assess the glucose level. So if the glucose level is low means then straight away you are going to treat the condition. So that is the way you have to follow. First, so I told unresponsive state, you have to check the scene, and then you have to check the response of the person, then you have to check the pulse and then respiration. If both things are there means straight away you are going to assess the like your glucose level. If the glucose level is low means you have to straight away treat the condition with the dextrose. But if the person glucose also all right means, so means the level is not level, hypoglycemia means again you have to rule out the some other causes. Might be there are lot of reasons like hepatic encephalopathy, uremic encephalopathy. So CVA, seizure also post-ictal, and that post-ictal stage the person will be drowsy. So you have to think in the term. So that is why remember, if it is not a cardiac respiratory arrest, straight away the next step you have to do the glucose assessment. That is why I stressed this much. And then this is what the assessment point. So mainly in other cases, so if you rule out the person of hypoglycemia, you can go with an dextrose. Unless otherwise, you should not go with an dextrose as solution. Means mainly in the case of CVA, like stroke cases, dextrose containing solution are contraindicated. That is why if you rule out the person of hypoglycemia, then you can treat the person with a dextrose containing solution. So this is what the in-hospital investigation. You have to do the field glucose test, that is glucometer, serum insulin test. So once if you found the person have hypoglycemia in hospital, before correcting the dextrose, you have to take the serum insulin test, and then you have to take the C peptide level. So serum insulin test, that will measure the how much insulin we have in our body. C peptide level is one of the marker. So it is a marker whether our body is secreting insulin or not. So the level will be like a 0.5 to 2 nanogram per milliliter. So if the level is too high means your body is secreting too much amount of insulin. If the level is too low means your body is secreting too low level of or minimal level of insulin. So that is the marker C peptide level. And then as usual you have to do the FBS and then postprandial blood sugar also. So management part, again we have to follow the, if the person is unconscious means you have to think about the airway threat. So you have to manage the airway, breathing, and then circulation, disability, exposure, everything you have to keep in mind. So what is the ideal treatment means, so again coming to the same two group of people. First group of people, those who are awake and then alert, oriented or disoriented cases. So first you have to check the symptoms, second you have to check the glucose level. So if the person is unconscious, but if the person able to take orally intact, gag reflex means there you can administer glucose through the oral route, peroral route. So the rule is, so here we have a rule of 15. Okay, rule of 15, rule of 15. So this is what you are mentioning, seeing here, right? So this is the rule of 15 that is given by the American Diabetic Association. So what they are telling means you have to give the 15 grams of carbohydrate, and then you have to wait for the 15 minutes. Then after 15 minutes in your glucometer you have to reassess the blood glucose level. There you can see the 15 milligram per deciliter rise in the plasma glucose level. So 15 gram you have to give, wait for the 15 minutes. After 15 minutes you have to reassess the person's glucose level by glucometer. There you can see the 15 milligram per deciliter rise in the plasma glucose level. That is called the rule of 15. Okay, if it will happen in the, it should done in the only the person who have a awake, alert, intact gag reflex. Okay, if so this is the 15-15 rule, keep in mind. So in practical, so some other institution they have glucose tablets or some gels like a thing, gel, those are things available. But if you don't have anything means you can give the normal sugar or household sugar also there, and then you can, or else you can ask the person to take the food. So those are the ways you can follow. Carbohydrate rich food you can give to the person. So if the, in the second category, so this is the category of those who have intact gag reflex can able to take orally. In other category, if the person have a altermentation or if the person have a unconscious state means there you are going with a dextrose containing solution. So ideally we have to give the 12 to 25 grams, or you can fix your mind with a 25 grams of dextrose we have to give to the person. Okay, in previous first scenario we told 15 gram, here the person is unconscious, you have to treat the 25 grams. Okay, 25 grams of dextrose containing solution. So we have a various percentage, dextrose in various percentage, like we have a percentage of 25 percentage, we have 5 percentage, 10 percentage we have, right? So ideally you have to give the 25 grams. So if it is a 25 percentage dextrose means you have to give the 100 ml. If it is a 50 percentage means 50 ml. If it is a 5 percentage means 250 ml. So whichever, irrespective of fluid, irrespective of dextrose percentage, you have to give the 25 grams. Okay, and then if it is a pediatric cases means there you have to give the 0.2 milligram per kg. So this is the one type. And then one more drug we have, that is called the glucagon. So glucagon ideal dose is 1 mg. The advantage in glucagon, you can go with an IM route or IV route or subcutaneous route. That is the advantage we have in the glucagon. One more thing, glucagon you can see in the pen format. So that which for anaphylaxis we are using that EpiPen or adrenaline pen, right, auto injector. The same format we have in the glucagon also. So the glucagon also available in the auto injector format. So you can take and then you can inject into the intramuscular or intravenous also we can go, or subcutaneous route also we can go. So we can see the recovery of consciousness within 15 minutes. So within 15 minutes the symptom will resolve. So this is the way you have to treat. So if the person have a because of the hyperinsulinism means reactive hypoglycemia means you have to target the glucose infusion minimum 24 hours or minimum the duration of drug action. So as like I told, if it is a human atropine means that is action of 4 to 6 hours. So the whole 6 hours we have to continuously reassess the person, we have to treat with the dextrose containing solution. So if the person may take a mixed start like a thing means that have action of 10 to 12 hours. Okay, so you have to treat the continuous 10 to 12 hours infusion, you have to target. So that is the way we have to treat the condition. So remember, mainly dextrose only for the hypoglycemia cases you have to give. If you are not sure about the hypoglycemia means don't give the dextrose containing solution. So that is why I give an example like a CVA cases and a dextrose solution contraindicated. Okay, this is the two group of people. First group of people, remember that 15 rule, those who can able to take orally, there we are following the 15 rule, 15 gram of carbohydrate, wait for 15 minutes and then reassess the glucose level. There you can see the 15 gram elevation in the blood glucose level. And then second category, those who are unconscious, or if you are choosing the parenteral route means there you have to ideally you have to give the 25 grams of dextrose containing solution. Either you can go with an 5, 10 or 25 percentage, but the dose is 25 gram. And then one more drug we have, that is the glucagon. Ideal dose is 1 milligram. Advantage here is either you can go with an IM or IV or subcutaneous route. And finally, if it is a sulfonylureas induced or if the hypoglycemia because of hyperinsulinism means based on the duration of drug action, you have to treat the condition. You have to administer the glucagon. Okay. So do your best. Shalom.